My name is Michaela Antelek, and this is my case study presentation. The client my case study is based on is a 14-year-old Hispanic transgender male. The client is currently single, unemployed, and homeless. Due to family dysfunction and a lack of structure and consistency, the client struggles to make and maintain progress in treatment, self-regulate, and engage in age-appropriate behaviors. The client is the second oldest of 5 children. They have an older sister who is 16 and 3 younger sisters who are 11, 10, and 6. The client's biological parents have been divorced since the client can remember and currently have new partners. The client currently lives with their mom and visits their dad on occasion. Due to housing and income stability, the client, their mom, and their siblings are currently homeless. Considering that all of the client's siblings have behavioral issues and their mother has lupus and cancer, the client takes on a parentified role in the household. The client has a history of experiencing physical abuse from dad and witnessing domestic violence between their mother and various partners over the years. Due to the client's life experiences, they have been displaying symptoms of poor mental health since the age of 7. Growing up, the client was closer to their mom and spent time actively avoiding their dad. The client feared their dad and when presented with opportunities to visit him, would turn them down to stay with their mom. Present day, the client continues to be close to their mom and only visit their dad on occasion when other family members are available to go with them. After reviewing a summary of this case, a few presenting behaviors can be identified. Due to the client's poor grades and school attendance, they have been held back and are still currently in 8th grade. The client also struggles to emotionally self-regulate and experiences symptoms of anxiety and depression. The client is evidently over-parentified, and the client reports avoidant behaviors. The client possesses many strengths that can be implemented into their treatment. The client is resilient, resourceful, smart, and willing to engage in treatment. When the client does delegate time to their academics, they can get good grades without much assistance from school staff. The client reports being artistic and engaging in activities such as painting and drawing. The client states that these activities help them to relax when stressed or overwhelmed. The client's family system also presents as resilient, as mom has been able to establish temporary emergency housing to make ends meet with the help of community supports. The client meets the criteria for post-traumatic stress disorder, or PTSD for short, as evidenced by insomnia, recurrent distressing memories, dreams, persistent negative beliefs about themselves and the world, markedly diminished interest or participation in significant activities, problems concentrating, and a persistent negative emotional state and inability to experience positive emotions. The client actively avoids external reminders that trigger distressing memories, thoughts, or feelings associated with the traumatic events they have experienced. The client describes the world as scary and unsafe, and themselves as not enough to help their mom and their family. Assessments that could be used to confirm a diagnosis is the PHQ-9, or Patient Health Questionnaire, the GAD-7, Generalized Anxiety Disorder Screening Tool, and the TSQ, which stands for Trauma Screening Questionnaire. When treating this client, it is important to consider the context in which their symptoms have manifested. Since the client's symptoms have been heavily influenced by familial dysfunction and other environmental factors, a systems perspective should be considered. Marriage and family therapists, or MFT, specialize in addressing relationship and family dynamics and can address a wide range of issues including parent-child relationships. This service could be beneficial for the client as the client struggles with enforcing boundaries with their mother and as a result becomes over-parentified. To implement this service into treatment, the client's treatment plan, goal, and objective can be as follows. For the goal, the client and their family will participate in MFT for at least one session a week, as evidenced by a reduction in familial dysfunction and client parentification. Their objective would be the client implements skills learned in MFT at home at least 2 out of the 7 weekdays, as evidenced by a reduction of parentified behaviors. The client also struggles to cope with symptoms of PTSD, which can be addressed by integrating elements of eye movement desensitization and reprocessing, or for short EMDR, and cognitive behavioral therapy, or for short CBT, into treatment. EMDR will address the client's symptoms directly related to trauma, which have resulted in sleep disturbances, nightmares, and an inability to concentrate. The client's treatment plan goal and objective could be as follows. The goal could be the client will collaborate with their therapist at least once a month to desensitize and reprocess traumatic memories, as evidenced by a reduction in the client's score on the trauma screening questionnaire. Their objective could be that the client will be able to form positive beliefs and insights and report such beliefs and insights to their therapist as a result of engaging in EMDR therapy at least 3 times a month. CBT aims to assist clients in replacing dysfunctional constructs with more flexible and adaptive cognitions. CBT will address the client's experiences with excessive worry and guilt in relation to the well-being of their mother and persistent negative beliefs and emotions. The client's treatment plan and objectives could be as follows. The client's goal could be to collaborate with their therapist at least once a week to reframe negative thoughts and feelings, as evidenced by a reduction of anxiety symptoms. Their objective could be the client will implement skills learned in therapy to combat negative thoughts and feelings at least 2 out of the 7 weekdays, as evidenced by an increase in self-regulation. The framing question that you should keep in mind when reviewing the details of this case is, how do client systems, environmental factors, and traumatic experiences contribute to the development and maintenance of emotional dysregulation and functional impairments? It is evident that the material in this case emphasizes the importance of viewing clients from a systems perspective. A systems perspective enables social workers to frame the problem, understand potential causes, and identify critical leverage points of influence. As we reflect on the details of this case, symptoms have a detrimental impact on a client. Additionally, the material of this case highlights the importance of incorporating a trauma-informed approach to treatment. Trauma-informed approaches are practices that promote a culture of safety, empowerment, and healing. The details of this case indicate a diagnosis for PTSD and a need for trauma-informed approaches. After reviewing the details of this case, there are a few future considerations to consider. Although MFT was suggested to assist with familial dysfunction, it may be important to consider individual services for the other kids in this family. Additionally, since this family experiences transportation barriers, services will have to be accessible and Medicaid cabs would have to be set up depending on the appointments. Lastly, from a systems perspective, the client's mother is an essential part of the family system. With that being said, the client's mother is a single mom of 5 experiencing poverty, housing instability, and medical issues, and she will need her own services. Thank you for listening to the details of my case study presentation. Attached on this slide are my references. Thank you.